Now, we know United States has a very expensive healthcare system. ACA was enacted in March 2010 to combat this with primary goals of expanding healthcare coverage, lowering costs, guaranteeing more choices, enhancing the overall healthcare of our system. Has many provisions. Key provision 2717 is which one we're going to look at today. It is to ensure the quality of care. Has 4 major points: quality reporting, wellness and prevention programs, regulation, and study and report. And basically, if we look at here, it directs the Secretary of Health and Human Services to develop reporting requirements for health insurers on benefits, structure, and activities that work to improve quality of care. For instance, here, wellness and prevention programs like smoking cessation, weight management helps in combating cost. Quality reporting, mandatory reporting within a year from health insurance companies, and this report needs to be made public by the Secretary within a couple of years. And there is a penalty if not done. The rationale for ensuring the quality of care is accountability and public protection. There's an apparent disconnect between relatively high rate of healthcare spending and the relatively substantial deficiencies in quality of care and access to care provided. Also, the healthcare needs change. 27% of the United States people think that the healthcare system is not great, needs change. Another rationale is cost control through various measures. United States spends a lot more money. It spent about 17.4% of GDP in 2009. And the cost can be saved through preventing hospital readmission. If you look at the annual cost of Medicare hospital readmission, it's about $15 billion, and out of which 80% is actually potentially unavoidable. Disease prevention. It's important to prevent diseases, so the Medicare cost is lowered because it spends much more money when people have a higher weight than in comparison to people with low weight when they enter the program at age 65. Chronic illnesses, they account for an estimated 84% of the U.S. healthcare expenditures. So this needs another important way of managing and coordinated care. Each year, the average enrollee sees about 2 primary care physicians and 5 specialists from 4 different practices. Coordination of care is very important for such factors. Now, ethical factors. So the right to a high quality care. Everybody has a right to a quality care, and this is being done by changing the way ACA health insurance or health reimbursements work, because now it is more pay for performance, not pay for or fee for service. People have the freedom of choice to decide who, when, and where they seek the care from, and with the transparency that is required from this provision 2717, it grants the right to know for people. Some financial factors is healthcare cost containment, affordability of healthcare by promoting healthy competition, chronic disease management, and preventive services without cost sharing. So it's important that public reporting drives insurers to continuously focus on greater quality improvement efforts and promote healthy competition, thus making the health insurance more affordable to people. Now, let's look at the stakeholders for ACA. They're all listed here. We'll go through them one by one. Governmental agencies, what's the strength? There's standardization of reporting requirements, controlling cost. So there are a lot of government agencies that are for this. Weaknesses, there's too much government involvement, cost control affecting innovation and technology, and carriers are lacking uniform metrics for quality, for value-based care. And a lot of government agencies are against this. General public, great benefits is there's increased access to care, enhanced consumer choice and buying power, access to quality data, along with lifetime limits or denial of coverage. And this is great for people. So a lot of people are for this ACA. Weaknesses, there's right to autonomy is being challenged by mandatory healthcare coverage. And there's even penalty for not having insurance. And not many people appreciate this. And they are against the ACA for that reason. Looking at the political parties, the major strength is just from one side of political support. This law was put into effect. So it's a major strength. And this led to a big political polarization. I'm sure we remember the great government shutdown in 2013, all because of the ACA and mandation of this new provision. Healthcare organizations, hospitals, ACOs, clinics, the major strength is increased collaboration, profit through cost-effective care, better health outcomes. So a lot of them are for this. But there's also penalties for poor outcome. Some hospital that is in an undeveloped area, people may not seek timely care, so their rating lowers, and that just affects their public image, and that's a weakness. And it's also very hard for small businesses to stand alone. Patient-centered medical homes, they are mostly for this. They hire nurse practitioners, primary care physicians, cost-effective, preventive care, lessen the burden in the ER. So a lot of so it's important. It's helpful, but the weaknesses is there's no single type care delivery fits all. Relatively low tech, and it's still in the very early stages of development. Healthcare providers, some are for it, some are against it. The strength is, they're paid for value, not for volume, improved collaboration, credit for evidence-based practice, so it's good for them to perform. But weaknesses, there's also fear of personal financial risk, there's penalty, it's hard to stand alone, and there's a lot of pressure from consumer experience. So overall, it's a sustainable and transforming healthcare. There's elimination of disparities for certain healthcare services. There's improved quality of care, improved access to healthcare, and many challenges remain, such as disparities in qualities and outcomes by income, race, and ethnicity. And so, concluding point is, the provision 27 is an important provision that tries to control costs and increase quality of care. It's still at an early age. However, reports are encouraging future changes of the provision based on research and evidence. Thank you.